Here we can see the Indian Express. Today, today's editorial. Remaining within the Lakshman rekha is key as we embrace the festive season amid pandemic. It is the only way conquer COVID-19 is to motivate every citizen to become an ambassador of the war against COVID. In this article, Shashank R. Joshi particularly mentioned how every citizen a COVID warrior. Every pandemic have worst case scenario. We see earlier also in case of SARS, MERS. This fuels panic and fear at the times make makes us take decisions that are not guidance, prudence, logic, and evidence. Initially, India rose occasion initially screening airline passengers and then suddenly announcing nationwide lockdown. We know that initially India starts coronavirus testings. The passenger who are coming in India from abroad. Suddenly, Modi government announced nationwide lockdown. In this retrospect, we can say that lockdown is restricted movement made Indians homebound, but it also contained the pandemic and most definitely save life. Here we can say that most of the lives are saved, but the problem is migrant laborers are traps and they are struggling to get a livelihood for them. However, struggled livelihood and had to be gradually transported back to their homes. This created strain for the establishment. Mostly these are migrant laborers are came from UP, Bihar, Chhattisgarh, Odisha, West Bengal. Lockdown gave India time to prepare, but we had time to take an economic hit. We know that we have 2 months of lockdown in India, so that India can get more time to prepare. But we can see economic India is the most economically damaged country in the world. IMF predicts that Indian economy can contract minus 10.3% in financial 2021. Although India ramp up its healthcare infrastructure, healthcare sector responded proactively across the board. That clearly made a significant dent on the number of inspection and helped to keep fatality rate in check. Unfortunately, the sign of catastrophe often compels us to act impulsively. We tend to forget balancing between saving lives and hampering livelihoods. So I earlier mentioned that we can't balance these things. We save lives, but on the one hand we can save lives, but on the other hand those peoples are poor because most of the population of India is poor, so that their livelihoods are hampered. Those plans which, which are made on the basis of mathematical model are fail completely fail, unfortunately not often validate the biological world of lethal pathogens like coronavirus. Coronavirus COVID-19, generally COVID-19 is the short form of coronavirus disease. In 2019, systematically evidence-based research in public health can map the pandemic geographically and generate more informed decision making. The center and state government rose to the occasion, often relying on expert advice. However, the heterogeneity of India and the complexities in our system made implementation through things though. So that what are the lessons we have learned from the pandemic, and we are in position to deal with health crisis better. As I earlier mentioned, SARS and MERS are widely spread, but these cases of the SARS and MERS, SARS means severe acute respiratory syndrome, and MERS is Middle East Middle East respiratory syndrome. These two viruses are spread across the world, but in it can't hit India in that time at that time. So Indian health infrastructure don't know how to tackle with such a pandemics. Although the only one state, Kerala, has suffered from SARS and MERS, so it can effectively, so that it can effectively manage the coronavirus spread. But the other states of India are severely affected. Indians show enormous resilience. The data speak itself the second most populous country in the world and has one of the best recovery rates and one of the lowest case fatality rates in the world. India is the second most hit country by coronavirus in the world, followed by America. But it has the world best recovery rates, uh, and one of the lowest case fatality rates. Case fatality rates means we can see this is an number of COVID cases detected, and out of them, how many people are die because of COVID-19. It is often said that we did not test enough, but careful analysis of the Indian strategy shows that testing was scaled up from near absent base to the one of the largest testing capacity with faster turnaround time in the world. At the initial stage, no one knows how to test coronavirus patients. So at the initial stage, there is zero testing, but after thereafter, RT-PCR test starts, and at the initially only 10,000 to 20,000 cases India regularly tests, but now RT-PCR test plus antibodies test both combinedly test on the COVID-19 patients, and India regularly tests on the daily basis on an average 10 lakh cases. The result of antigen test is come in 24 hours, but RT-PCR test requires days more than one. It is something even larger countries, US and UK, struggle with. We still need more innovation that produce rapid solution saliva test. For example, CRISPR-based tests likely to provide cutting-edge dimension to the battle against the virus. We need to violate the we need to we need to validate the viral load cycle threshold values is the next research milestone that will help us assess who needs extra care among the infected. As we mindfully unlock the country, it is time to focus on protecting the most susceptible, those above 55 years of age with comorbidities. Comorbidities means a person with more than one disease. Example, one person is affected with one disease and plus diabetes or blood pressure, high blood pressure. These are the comorbidities patients. However, we can't be complacent about adults and youth who can be silent spreaders. They need to follow the COVID-19 Kavach mantra of using mask, following social distance protocols, being scrupulous about hygiene, self-care, self-protection. Atmanirbhar is the key to COVID-19 control. The virus is unpredictable and tricky. Localized transmission is well known in the community, and clear-cut containment strategy is mandatory. A strict result-oriented containment plan driven by sound public health science is still needed in hotspots. We have to track them, trace them, test them. The transmission trajectory of the virus has moved from the poorer urban slums to middle class localities and has seeped into the community. Indians have risen to this challenge because most of the migrants after the 1 month of lockdown they migrated to their homes from the more developed states like Maharashtra and Gujarat to other poorer states like Bihar, UP, and West Bengal, Chhattisgarh, Odisha, while also negotiating an infodemic that has often been full of myths. Demystification and allaying fears are important because most of the peoples are spreading the disinformation about the COVID-19, and most number of people in India are illiterate and uneducated, so that they don't know how exactly to react against the COVID-19 and how can we protect, because there is no hygiene maintained in India. But we have often seen extreme posturing in past few months. We now know that coronavirus is an airborne droplet which thrives in moist environments and is transmitted via saliva, nasal, throat secretion, and cup droplets. Apart from physical contact with contaminated surface, we need to minimize the activities that require physical contact. Exhaust fans and air recirculation in public kitchen and toilets can impact the disease transmission. So that if we use the air conditioned system, then 100% fresh air we require. Otherwise, if we use the same technique what we are using in our split AC, in no, in generally we are split AC we generally use in home. So this air is continuously recirculated. If one person is infected, it can uh, reinfect other persons. This is the main problem. uh, we can see 100% air circulation, fresh air circulation is conduct in a ICU. Gathering small, medium, or large can be potential spreaders. Avoiding crowds and breathing fresh air in well ventilated spaces is the way forward. We know that Bihar elections are came near. There are all the political parties take their rallies. Uh, Thousands of people are crowding there. So that how can we stop this? How can we avoid this? This is the main problem. So that gatherings and small, medium, or large can be potential spreaders. So political persons should aware of that their public gatherings not be such that this public gathering can infect the people in large quantity, or we can say in large numbers. Indian culture is full of feast and festival, and these often involve travel, movement, and interaction. The lockdown has impacted minds in mixed way. People are trapped between fear and recklessness. As I already tell you, people don't know how to react, and most of the time they are trapped inside the home. So that because they are now are mentally weak, so they are fear and recklessness. Remaining within the lakshman rekha. Lakshman rekha means boundary. We can say that a boundary between our home and outside region. Lakshman rekha as the key to embrace festive season with responsibility and caution. Indian have highest tolerance threshold for centuries, which now needs to be channeled in COVID appropriate behavior habits. Simple habits enriched in our traditional culture can be reinducted in our daily lives. From ancient times, simple habits in the Indians culture are reinducted, so that these habits are reinducted in Indian people daily life. Eating healthy protein rich food, but not in excess. Avoiding fried and fast food, as well as not eating excessively, will stand us in good stead. Eating slowly, eating on time, focus on traditional foods that build immunity holds the key. Exercising important from a simple Surya Namaskar. Surya Namaskar means we can say yoga. Surya Namaskar, this name is exactly the Hindi or Marathi word for yoga. Breathing exercises like pranayam to expanding and improving our lung capacity. Often chanting mantras and generate positive energy, reduces anxiety, and allows us to focus without fear. Sleeping well, sleeping on time, and sleeping early is also important. Humans need at least 7 hours of sleep, and sleeping early allows to generate healthy substances which are protective, like IL-10, interleukin 10, protective chemicals. We love we live in an era of digital overload, and it's important to digitally detox daily by engaging in hobbies, music, and activities which enhance positivity. The only way to conquer the COVID 19 is to motivate every citizen to become an ambassador of the war against COVID. It is the time citizens take responsibility themselves and take care of their fellow Indians and extricate the country out of pandemic with grace and dignity. So we hope that Indians can won the battle against the COVID-19. We can maintain the less we try to control the case fatality as low as possible. So see you soon in the next lecture.